Today we will be talking about a backward sacral torsion, also known in this case as a left on right sacral torsion. This is where the left iliosacral angle is more posterior and the sacrum is rotated left on the right axis. In this case, the left sacral base is stuck posteriorly. A basic overview of this technique is to first position the patient to the point of restriction, apply force in the direction of movement restriction and have the patient resist isometrically, then hold that contraction for approximately 5 seconds before moving the patient to the new point of restriction, and continue 3 to 5 times or until the movement of the restricted segment stops improving. For step 1, we're going to have the patient lay on the same side as the axis that they are rotated on. We're going to palpate L5 to monitor for rotation of L5 in the sacral base, and then push the patient's top shoulder back towards the table. Straighten their bottom leg and bring their top leg across their body to rotate their hips towards the side they are laying on. As we can see here, we are rotating the patient's top half back and then bringing their leg forward, rotating their hips. All the while palpating at L5 to make sure that we get as close to that movement restriction as possible at that restricted segment barrier. And then here it is from a different angle to get a better feel for how we're positioning the patient. And as you see, you can support their leg with your leg if you need to. Then for step 2, we're going to apply a force by gently pushing the patient's foot towards the ground and having the patient resist isometrically. We're going to hold for 5 seconds and then move the patient to the new point of restriction by bringing the leg more forward. We will repeat that 3 to 5 times or until the movement restriction stops improving. So here it is from this angle. You can kind of see how we're pushing their leg down and having the patient resist that with their leg. And then from a better angle, just to see how that force is being applied. So we're moving them to the new point of restriction, telling them to hold for about 5 seconds, and then they will relax as you see, and we can move them to that new point of restriction, all the while palpating at L5 to check for movement at that segment. Then for the exercise for a backward sacral torsion, otherwise known as a left on right backward sacral torsion, we're going to have the patient lay on their back, then they should rotate their hips to the right and straighten their bottom leg while keeping the top knee bent. We're going to have them then place their bottom hand against the top of their leg and try to bring their knee up towards their chest while resisting with their arm. They can repeat this 10 more times and then rest for 1 minute before repeating the set 2 more times for a total of 3 sets of 10. So you can see here as the patient starts out sitting, then laying down, then she's rotating her hips to one side, straightening out her lower leg, placing her hand against the top of her thigh, and pushing up into her hand isometrically.